Hey, everybody. Welcome to this episode of the Future of Medicine podcast. I am your host, Dr. Wenzel, and I am joined, as always, by Jen Justus.
Hello.
Hello, Jen.
How's it going?
You look very Nashville today.
Thank you.
I like it. This episode is called Don't Sleep on Your Sleep. This is really about a topic that you and I have been talking a lot about recently and more and more. And we've always known that it's very important, but yet it continues to be a top topic that is elusive, ignored, underestimated, and mysterious, kind of all wrapped up in one. But one thing that is not up for debate is the significance of it. Ironically, I am in search of it for myself. And if you could somehow bottle it and sell it to the world, I think it would sell a lot.
I'm a champion sleeper, that's for sure.
I mean, all time.
It's one of the things I'm good at.
One of the many things that you're incredibly good at. This first section of this topic is really about why high quality sleep is critical. What I did not want to do in this episode, Jen, is to give another kind of like recipe, 7 steps to great sleep, because frankly, I don't have it figured out.
Well, I think it's individualized. I mean, there are certain things that work universally, but you've kind of got to do some tinkering and figure it out for yourself. Yeah,
and I couldn't agree more. And I haven't always felt that way, because it felt like there's a one singular perfect diet. There's a one singular way to fall asleep. There's a one singular, like, that's just not real.
Yeah.
Practically, that doesn't shake out. So I thought we would start this journey by really getting very clear on why it's so critical. And I think the first thing to say is that although critical, it is incredibly mysterious. Not only how to achieve it, but what the heck is it? Like, why do we need it? All we know is that we get deprived for 2 weeks, we die. Like, we're a system of processes and electricity and hormones, and like, what in the world takes place in our nervous system and in our brain when we're sleeping? And the answer is not many people know. We just need it. So it's very, very mysterious. However, I think one of the things that eludes people is, or not eludes, but deceives people, is that because it's mysterious and it's not very good, I don't put any effort towards it. And I think you end up sleeping on your sleep. Yeah. Like, you're just like, well, I wish it was better, but I don't have any active effort or active strategy ongoing to improve it. Whereas other critical areas of our life, our health, our relationship, our finances, we're always tinkering and trying to get better. Sleep is just not one of those. I think why it matters, number one, you spend half of your life at least trying to get it, right? You're in the bed trying to sleep. And anything that you spend 1/3 or 1/2 of your life doing, it's clearly something that's essential.
Yes.
And it is a major, it'd be like, I wish my breathing was better, but I just won't pay any attention to it. Something you do your whole life. Like, you just would never do that with something else. Talk to me about clinically how you maybe personally experience a suboptimal night of sleep. Like, because you're so tuned that a singular non-ideal night can really throw you off.
Yeah, and it's not just for one day, it's like a few days in a row. So
that you feel it.
Yeah. I mean, you and I both do a really great job assessing sleep with our members. I honestly don't know the last time I've personally been asked about my sleep by a healthcare provider, but it's that important to us to talk about with our members. So for me, if I'm just a zombie, I can't perform well at work. I have a lot of brain fog. Just to be that fatigued from a not quality night's sleep will throw me into a tailspin for like 2 or 3 days. You know, and a fun person. I like to go out. I like to do things, but I'm typically in bed by 9:30. So anytime, if I'm at a concert or if I'm doing something fun and it's a later night than that, or there's some other variables involved that I don't normally introduce before bed, which we'll talk about later, I'm just a wreck.
Yeah, and I'll say that it's noticeable when you have had a singular night of rough sleep. I will also tell you, in knowing you for 6, 7, 8, I don't know how many years I've known you, a long time. I can think of on one hand how many times you've had more than one night of bad sleep. It almost immediately you recover the next day because you're like, not doing that again.
I remember when I was going through my nurse practitioner training, and it was, the workload is just intense. And, you have to stay up later than usual to get projects done or assignments done, and then you're up early for clinicals, and it's just...
There is no routine.
That 2.5 years was just not great for my sleep, for
but
my
you
health.
Still pulled it off.
Yeah, but it was tough. I didn't like it.
Talk to us about how you clinically experience a more chronic sleep fatigue from the patients that you take care of. Like the one night really throws you off, but like what do you see clinically when you are assessing this variable in your patients? What are the common themes that show up?
Well, I think it's interesting. That's a great question. We deal with a lot of high-performing individuals, right? A lot of entrepreneurs, CEOs, those type of people. I think they just get used to, it's similar to like people that get used to an elevated blood pressure, and then we normalize it and they don't feel great even though it's normal, or an elevated blood sugar, and then we normalize it and they're like, whoa, like I'm feeling these side effects. For sleep, I've dealt with some members of ours that they have learned to function on like 4.5 to 5 hours of sleep.
It's remarkable. And
I honestly don't know how they do it. I would love to see how they function on 8, even like 6 to 7 to 8 hours of sleep. I think it would make a remarkable difference in their life, but they've just adapted. And I think that's kind of how we are with a lot of negative health multipliers that we've been talking about lately. But they somehow make it through.
Yeah, I mean, humans have an incredible capacity to compensate, especially as we're younger. We have a lot more elasticity, neuroplasticity, resilience. Our hormonal environment is more optimal. Like, a really rough week in high school could lead to a weekend where you sleep for 16 hours a day and you're totally recovered.
Yeah.
That doesn't play out at 35 or 55 or 65. You can't, first of all, you don't have that kind of it's much more elusive. You don't just decide to sleep.
Yeah.
And you don't end up pulling that off. And even if you were, it wouldn't be enough. I think you really, really bring up a great point that there seems to be kind of this correlation in our practice with the higher productivity one is used to achieving, the more that person will be inclined to overlook how awful they actually feel.
Yeah.
And if they're talented enough, and this is where it gets a little interesting, because like the more talented and the more underlying kind of capacity to perform, the deeper the sleep deprivation goes and longer it goes, because they're able to rally. Maybe they're good at systems and processes that allow them to kind of move the can down the road, so to speak, and not actually address a real fundamental problem. And sometimes just over caffeinating or stimulants, or it's just it whatever the mechanism of compensation is, they become very good at it. And I think it can become very deceiving when you're auditing how you feel, like, A, how bad do I feel? And B, this whole thing called sleep is improvable.
Yeah.
So I see that a lot. And what happens is that in our world, someone either resonates as we address that, or we start seeing some physiologic impact to having this suboptimal sleep ongoing. And the number one thing I want to get out of this first section is that it is a multiplier, no doubt. But I don't want to talk about the benefits of getting good sleep as a positive multiplier. I want to position this particular piece of content as a negative multiplier, which you and I have spent tons of time creating content on health multipliers. And this is a health multiplier, but I'm intentionally going to take this as a negative spin.
Oh, yeah.
That if you don't unlock this, you will receive a negative health multiplier downward, because there are infinite amounts of areas of our life pertaining to health, including emotional well-being and these types of things, that are dramatically impacted from being in a chronic state of sleep deprivation.
It's that important.
It really is. And just as an aside, anybody who's listened to us know how much we talk about diet, how we talk about training. I would submit that sleep is as important as diet. There are some people who even believe it's more important than diet or fitness, that you could have a perfect diet and perfect fitness. If you don't sleep, you get minimal benefit from the other critical things. Not only that, but you also get the negative impact. So this is a real big deal. This second section, I really want to talk about the consequences of not committing to optimizing your sleep. And again, we talk about a lot of positive multipliers. This is really the negative multiplier aspect of not getting sleep right. Look, there are huge risks for cardiovascular disease. I think that study after study show a clear link to increased risk of cardiovascular disease, whether it's hypertension, stroke, heart disease, directly linked to lack of deep restorative sleep. Some of that, especially if the reason you're not sleeping is due to apnea, right? Sleep apnea, by definition, lack of no oxygen, you're not breathing. So these micro experiences every night. I was just looking at a sleep study of one of our members. He had 80 apneic episodes in one night.
Wow.
80. That means 80 times in one night of sleep, he stopped breathing.
Wow. That's scary.
Multiply that lack of oxygenation to the heart times decades. This is why there's no confusion around the cardiovascular risk for sleep apnea. And you can't just wish your way through that. That's a big deal. Metabolic disease, insulin resistance specifically. If you're not getting deep restorative sleep, there are plenty of studies that show in just otherwise ideal metabolic environments, short periods of time of sleep deprivation can facilitate fast tracking towards insulin resistance, which, as we know, is the root physiology of all metabolic disease. Insulin resistance leads to diabetes, inflammatory, atherosclerotic process, instability, hypertension, obesity, all of these things. Chronic fatigue affecting decision making.
Do you have some personal experience with this?
Oh my gosh. On the negative side, for sure.
Yeah.
And even in your own experience on one night, you said brain fog. Working nights, working in the ER, overnight residency, there are clear studies linking to one 24-hour period of no sleep to be equivalent to being legally intoxicated.
Whoa.
And we were actually told that in residency. Hey, by the way, driving home post-call is the equivalent of driving drunk.
Wow.
Think about that for a minute. One night, your response times, your decision-making, your processes, the way you make decisions, it's lethargic and it's not crisp.
Oh, yeah.
And we don't have a lot of people who work manual labor in our job, in our practice. The majority of our clientele are thinkers. They make decisions for a living. They're leading. They're thinking. They're problem solving. They're innovating. The impact on your thinking, and one of the most common things we hear is brain fog. I'm fatigued. A lot of that has to do with hormones, but a lot of that has to do with you're just always tired.
Yeah.
Let's see. What else can we talk about? Tell me about some negative impacts some consequences that you're seeing, as I've rattled off a few, in your own clinical practice.
I think you touched on most of them, but for me, it's, you as a clinician, you have to do a deep dive into all the variables, right? Mm-hmm. So we look at diet, we look at exercise, we look at hormonal status, family history, all those things. But sleep is one of those variables that we talk about and that we dive into with our members. And, if it's off, we have to fix it. Mm-hmm. Bar none.
Mood.
Yep.
I just thought.
Oh, yeah.
Depression, mood, mindset, just how your joy.
Your want to. You talk about the fire in the belly, with testosterone replacement therapy. But gosh, if you're not getting good night's sleep.
I got as much want to as I know of anybody. Mm-hmm. And when I'm tired, I just lose my tailwind. Yeah. And actually, it's worse than that, because I lose the drive to do, but then it creates a conflict in my mind. Why am I need to be doing this? I actually want to be doing this, but yet I'm not getting up and doing it. Mm-hmm. Like it's very devastating. Yeah. And so, all right, I think that outlines kind of the chronic consequences. This last section, I want to talk about best practices for getting quality sleep. Again, not from a standpoint of like, here's a recipe and a formula, but let's touch on some things that we understand really comprise good sleep hygiene, best practice, and then maybe, since you are the genie of great sleep, what is in your magic potion? So, again, I don't want to pretend like I have it figured out, because I do not.
But you're working on it.
I am working on it. My sleep is, it's reasonable. And anybody who knows me knows that's like basically failing, especially in something that is really, really important. Mm-hmm. But I'm actively working on it. This has been 2 years. I wear an Oura ring, probably with the exception of about 10 or 12 nights over the past 2.5 years. I have every night tracked data, and I'm beginning to get really neat insights. If I drink too much alcohol or alcohol too late, that's very disruptive. If I eat too late, that's very disruptive. There's a clear correlation to my, what I call the pending column, how many things I have going on in life, business, patients. I don't sell cat t-shirts. I take care of humans. Right. And so sometimes all is well in the world, and I rest more like what I'm capable of. But currently, right now, as we're recording this, I have 5 patients that have been on my mind nonstop. Mm-hmm. Everything from knee replacement to thyroid cancer to having a heart cath, like a mass, working up a mass in the abdomen. I'm thinking about all of these people and all of their families and all the implications and what are we going to do and how are we going to think about this. Turns out that's pretty disruptive to your sleep.
Right.
And I still am able to pull off okay sleep, but it's not acceptable to stay here. And I think, and I'm going to let you go with this, but I think number one is you have to commit to making sleep a priority. Like anything in life, the first step is you have to sell yourself that it's an idea that you're willing to pursue, and then do it. Yeah. So I've committed to making sleep a priority, even though it's completely elusive to me currently as of the spring of 2022. Talk to me about best practice as like the gospel according to Jen.
Oh man.
On sleep. No, seriously.
First of all, I do commit to making it a priority. I got a text from a patient last night at 10 p.m. and I didn't see it because I was in bed asleep. Yeah. So, I typically go to bed at the same time every night. Weekends are a little off because I stay up later, obviously, but typically in bed by 9:30. Now, full disclosure, I don't have kids. So I think those that have kids, that could really be difficult, but it can be done. Your kids should have a normal bedtime and a routine bedtime.
Mm-hmm.
You should too. So that being said, I just wanted to throw that out there. I also don't drink a lot of alcohol. So I'm like you, where if I drink or I drink too much close to bedtime, I'm going to be up all night. We recently had a team dinner where there was a little wine flowing, and
a little bit.
I had a little bit more than I usually do, actually a lot more. And so I was literally up all night, just not doing well with that. My little adrenal glands were
Just very
trying to
disruptive
keep
to you.
up. Also, as a perimenopausal female, I have optimized my hormones. So
Mm-hmm.
I take progesterone at night, and that really helps with sleep.
That was a game changer for you.
Yeah, because that was really the first sign that my hormones were changing before menopause, and I'm not menopausal, but I would routinely wake up, and I hear this a lot from our females in their like mid-40s to late 40s. I wake up between 2 and 3 in the morning, and I just can't get back to sleep.
Yeah.
And once we add progesterone into the mix of other hormones that we optimize, their sleep becomes really
So much better.
So much better. I, like you, I track my sleep with the Oura Ring, which I love.
Mm-hmm.
I don't wear it routinely every night like you do, but I am able to at least.
Well, when you get a score of 90 or above every night,
Sorry.
You don't have to be
it's
as
another great night of sleep.
Another perfect night. Look at me.
Right.
Perfect news is kind of
Yeah.
boring after a while.
Right.
For me, by the way, for anybody who has an Oura Ring, knows how the sleep scores work. Jen, you can count on one hand how many times she's not had a 90 or better.
Yeah.
I have yet to ever have a singular 90. I've gotten 89 once, 87 half dozen times, but
We're going to get you there. Don't worry.
That's right.
You know what is weird, what interesting is the week before my positive COVID test, my sleep was crappy. My heart rate was elevated on my HRV status with the Oura Ring. And I'm like, what is up with my heart rate? Like, I've not done anything differently. And it kept saying, you need to rest, you need to rest. And I'm like, I don't understand what's
So
going on.
2 months ago, Jen and I both got COVID the exact same day.
Yeah.
We had been going 2 years avoiding this thing. And
Our
both
worst nightmare was realized.
got diagnosed the same day. I told Jen I thought my Oura Ring broke because my score was like 54 or something.
I remember that, yeah.
But I felt horrible. But
Yeah.
the ring picked it up. The heart rate
Yeah.
variability, my average heart rate that night was like 107.
Mm-hmm.
Whoa. It was
Yeah.
very, very...
I couldn't figure it out.
It's an incredible technology, and it goes a long way in measuring the things that you can't see, taste, smell, hear.
Mhm.
So you can start picking up patterns.
I also use melatonin at night too,
Yep.
so that has really helped.
Yeah, a lot of people have hit or miss with melatonin. I mean, I think melatonin is a great strategy. I think not all melatonin is created equal, and I think in general most people underdose. And as long as you're not having a negative side effect, you should explore some of the higher doses of melatonin before you definitively say it doesn't help me.
Yeah.
What else in your world?
Well, my bladder's the size of a walnut, so I try not to drink a lot before bed because I'll be up in the middle of the night, and then that just...
But that's behavior modification, right? So
I just can't get back
know
to
that
sleep.
about you, so you don't consume a lot of liquids at night.
Right. Try not to. Try not to eat really close to bed, like you've said.
What time is your dinner time? You're an early eater. I think.
We're usually done by 6 or 6:30.
Yeah, that's great.
I know.
And in the summertime, that's wonderful because you could even squeeze in an evening walk after dinner without it before it gets
But
dark.
I have to be careful with that too because exercising too close to bed is a no-no for me too. Like I can't do that.
That is.
There's a lot of people I talk to that they're like, oh no,
helps them
I
sleep.
work out at like 9:30 at night. I'm like, oh my gosh, I could never do that.
Yeah.
But yeah.
But I think that's, as we were prepping, I think that's one of the points that I want to make sure that we get across because I think you really nailed it on the head. And that is what we're suggesting. I mean, there's some obvious things, but then there's this incredible amount of white space where you have to figure out what's best for you.
Yeah, I was just going to say I know these things about myself
Right.
because
the bladder,
I've been working
the
on it.
exercise. Those are Jen specific.
For me, I'm real sensitive to light as well. So I got this new charger for my iPhone and my iWatch or my Apple Watch that sits by my bed. But the light is like, It illuminates the room, and I always have to put something in front of it to block it. Otherwise, I won't sleep well.
Well, I think a dark, quiet room is pretty universally accepted as good hygiene. I don't know that there's too much variability. I mean, you might be an outlier. Just like most people need 7 to 9 hours of sleep. There are a few outliers, but, you know, not many.
There's one thing that I have that you don't have, that you're better at me. You don't have a TV in your bedroom, do you?
Negative.
Yeah, we have a TV in our bedroom. It's awful.
Yeah. Yeah, I'm very grateful. Although I don't think I would be very tempted to mess with TV, because when it's bedtime, I go to sleep like, if bottling up falling asleep was, I could sell it to the world. It's staying asleep. You just pull off both.
Yeah.
My wife, once she's asleep, she does a good job staying asleep, but she's the world's worst at going to sleep. So like that TV in the room would be very disruptive, because she would definitely watch TV. I think you got to commit to having optimal sleep hygiene.
Yeah.
And I think late meals, alcohol, dark, quiet rooms, no stimulants like caffeine beyond like 3 or 4 p.m. Those are kind of the obvious places to look. But beyond that, it's the optimization of the individual.
Yeah.
If you're a perimenopausal woman, you've got to be thinking about progesterone. Yeah. Male or female, thinking about melatonin and really increasing the quality of the melatonin that you're taking, and if you're not having negative side effects, really starting to move some of those doses a little higher potentially.
So how many guys that you've optimized testosterone in report better sleep?
Almost all, if they report not sleeping great to begin with. When you go harder physically through the day, you will, because a lot of men especially, at the end of their day, they have tremendous mental fatigue, and their bodies have virtually done nothing except exist. They have exerted zero mechanical stress all day long. So when you go a little harder, you start adding a little bit of a workout routine, you start taking the stairs, like those kind of things. All of a sudden you start matching the physical exhaustion with the mental exhaustion, and we tend to see in men a real nice improvement in sleep quality, especially sleep initiation. I think beyond customizing your sleep hygiene, I think you got to start measuring. You got to start keeping score. You know, as they say, you can't manage what you don't measure. I think the Oura Ring, or there's Whoops, there's other technology, some wearable, some reliably consistent and accurate sleep tracking. We just happen to like the Oura. I think the science is the best. I think the Whoop is really good, but I don't like wearing bracelets. Yeah.
The iWatch or the Apple Watch will do it, but I don't.
Well, it lights up like a Christmas tree, and it's very disruptive to me.
And the Oura Ring is Oura, if people want to check it out.
Yeah, auraring.com. And it's not super expensive, but it's $200 or $300 for the ring, and there's no ongoing fee, so it's a one-time investment. You get tons of data. The user interface is really great. I think that if you're over 40 and you have crappy sleep, you need a sleep study. We need to make sure that there isn't an apneic phenomena going on, potentially seeing an ENT. I'm going to see an ENT in the next month or two, getting my sinuses examined, make sure that there isn't something anatomically going on that is preventing my sleep. You know, manage the manageable, modify the modifiable, and then you manage the things that are non-modifiable. And
they can do them at home now, which is great. You know, you don't always have to go to a sleep center, but be in your own bed, be in your own environment.
Yeah, I think the take-home point is here: don't sleep on this. Yeah. There may not be a clear path to a perfect night's sleep for you that's declaring itself, but it's one of those few things that is worth pursuing a lifetime to try to find. Because as soon as you improve it, it doesn't just fix your sleep, it improves countless other areas of your life. You start to now all of a sudden change the course of the negative impact to a positive health multiplier. Mood, metabolic, cardiovascular, like all of these things. So
very good.
Yeah, I think this was good. This is a great topic, and I hope to be able to talk more about it as we learn more about it. And the irony of the topic and me being terrible at it and you being amazing at it, I thought would produce an interesting kind of back and forth.
Yeah. But I have noticed now that you're at the ER.
Yeah, I mean, not working nights has been a huge thing. For me, I'm convinced part of my journey, I've only been out of the ER, coming up next month will be 1 year completely out of the ER. It's like a reset. My body has to relearn that every 7 or 12 days I'm not going to work overnight.
Yeah.
And being consistent with my rhythm, I have acceptable sleep, but it's not optimal.
Yeah.
But I still got a sleep study to do. I still have some things to do.
Yeah.
Could eat a little dinner a little sooner. I've got kids and I've got a business and there are and I've got real people that I take care of. So there will always be an ever-present vulnerability.
Yeah.
Sleep is just one of those areas that I'm always going to be vulnerable, as are you.
Mm-hmm.
But it doesn't mean that we just punt,
No.
keeping eyes on it.
Yeah. And it is achievable,
Yeah. And it's something you have to manage.
Yep.
Famous last words from Jen Justus.
Oh, gosh. I can't think of anything we haven't already said. Thanks, though.
Because you just drop so much
Oh, my gosh.
golden nuggets along the way. Well, I hope this episode was useful to folks. Share it if you think somebody would find use in it. And until we chat again, see you later.
Bye.